speaking. So today is a slightly more interesting subject, which in fact I read recently and probably got a slightly better idea. Now, often what do we see during intrauterine insemination is that there is a leakage of sperm or prepared sperm, which often comes out. And often you keep thinking, is it better to have almost all the prepared semen going in with having all the motile sperm going in, or is that leakage something which we should be unconcerned about? And so, whilst we do not have much information about it, there was a paper which I came across, and this was a paper which looked at the relationship between semen regurgitation and pregnancy rates with intrauterine insemination. So, and what they were asking was that, is there a relationship between semen regurgitation of a washed sperm sample or in intrauterine insemination and outcomes? So 1,957 intrauterine cycles were performed on 660 patients, and the mean age was quite younger women, and it was a retrospective cohort study. So what did I find out? That the presence of sperm regurgitation of a washed sample, the positive pregnancy tests were no different, and the clinical pregnancy tests also were no different, 15% to 15.4%, and the live birth rate was exactly the same. But remember that intrauterine inseminations have a lower chance of success, and that's something which you have to explain to your patients. The results were unchanged when you look at the factors as age, race or ethnicity, BMI, duration of infertility, medication, infertility diagnosis, or total sperm count. And what is the main area I'll say is if you look at it more closely to the study, those who had a lower total sperm count had a slightly lower chance of a live birth, and that's something which we do know occurs. So, what is it that we learn from this paper? It's a short paper, it's a retrospective cohort study, but it throws some light into suggesting that if you do have some regurgitation of prepared sperm sample, then it is still possible that you will see some regurgitation, and that should not have any impact on the chances of pregnancy. Once again, I'll say that the key factor which will tell you about the best chance of pregnancy is number of follicles, and also of the quantity of motile sperm, which is essential. So thank you very much.